Structurally similar prolactins are also secreted by the endometrium and the placenta. Metabolism of prolactin. Prolactin circulates unbound to serum proteins, and thus they have relatively short half-life of about 20 minutes. Normal serum prolactin levels is about 1.9 to 25 nanograms per milliliter among women and 2.5 to 17 nanograms per milliliter among men. Moderate elevation of prolactin can occur during pregnancy, in the postpartum period, in patients with renal failure, liver failure, hypothyroidism, in certain conditions like stress, or with the use of certain drugs like dopamine antagonists and in prolactinomas. Specific characteristics of lactotropes. The lactotropes differ from other endocrine cell types of the adenohypophyses in two major ways. The first being that the lactotrope is not a part of an endocrine axis, which means that prolactin acts directly on the non-endocrine cells, which is primarily of the breast, to induce physiological changes. The second of it being that production and secretion of prolactin are predominantly under the inhibitory control of the hypothalamus. Thus, during disruption of the pituitary stalk and the hypothalamo-hypophyseal portal vessels can all result in an increase in prolactin levels, but also cause a decrease in adrenocorticotropic hormone levels, along with a decrease in thyroid stimulating hormone, follicular stimulating hormone, luteinizing hormone, and growth hormone, which can occur due to surgery or some physical trauma, road traffic accidents, or also in certain infiltrative diseases like sarcoidosis, hemochromatosis, so on and so forth. Prolactin receptor. Like the growth hormone, prolactin also acts through the cytokine receptor family. It produces its effects by means of the JAK-STAT pathway, otherwise termed as the Janus kinase pathway. It dimerizes and activates the Janus kinase or the signal transducers and activators of transcription of the JAK-STAT pathway, thereby causing intracellular enzyme cascades. The actions of prolactin. The primary action of prolactin in humans is related to breast development and function during pregnancy and lactation. In a breast which has been primed by female hormones, the estrogens and progesterones, prolactin induces and maintains lactation by stimulating the synthesis of milk. Prolactin produces milk by proliferating the lobulo-alveolar epithelial cells. Its effects on the breast involve increasing the levels of mRNAs and subsequently production of casein and lactalbumin in them. However, the action of the hormone is not exerted on the cell nucleus and is prevented by the inhibitors of microtubules. The stimulation of numerous mechanoreceptors in the nipple activates a chain of neural afferents leading to the hypothalamus. This results in the release of prolactin-releasing hormone, which in turn stimulates the prolactin secretion. Normally, this mechanism plays a subordinate role, but it becomes important when the infant is weaned off. Prolactin also inhibits the effects of gonadotropins, possibly by an action at the level of the ovary. It also prevents ovulation in lactating women and inhibits the gonadotropin-releasing hormone secretion, leading to a decrease in levels of both FSH and LH. Prolactin blocks the folliculogenesis in ovary. So during lactation, there's amenorrhea in females, and prolactin is the hormone responsible for lactational amenorrhea. The risk of pregnancy to a woman who is fully breastfeeding and amenorrheic is less than 2% in the first 6 months. In men, Low levels of luteinizing hormone due to prolactin leads to low testosterone levels, thereby decreased spermatogenesis, and a loss of libido can ensue. The function of prolactin in normal males is unsettled, but excess prolactin secretion can cause erectile dysfunction in the presence of tumors. The regulation of prolactin. The release of prolactin is normally under the tonic inhibition by the hypothalamus. This is exerted by dopaminergic tracts that secrete dopamine in the median eminence. There is also evidence for existence of a prolactin releasing factor. The exact nature of this compound is not known, although many factors, including TRH and hormones in the glucagon family, can stimulate the release of prolactin, which is one of the many hormones released in response to stress, surgery, fear, stimuli causing arousal, and exercise are all effective stimuli. As is the case with growth hormone, sleep increases prolactin secretion, and prolactin has a pronounced sleep-associated diurnal rhythm. However, unlike growth hormone, the rise in sleep-associated prolactin is not associated with a specific sleep phase. Drugs that interfere with the synthesis or action of dopamine increase the prolactin secretion. Many commonly prescribed antihypertensive drugs and tricyclic antidepressants are dopamine inhibitors. Bromocriptine is a dopamine agonist that can be used to inhibit the secretion of prolactin. Somatostatin, thyroid-stimulating hormone, and growth hormone also inhibit prolactin secretion. Prolactin initiates and maintains lactation. The factors affecting the secretion of prolactin. Prolactin secretion is stimulated by sleep, nursing, breast stimulation in non-lactating women, stress, hypoglycemia, strenuous exercise, sexual intercourse in women, stimulation of the nipple, pregnancy, estrogens, hypothyroidism, thyrotropin releasing hormone, vasoactive intestinal peptides, phenothiazines, and butyrophenones can all cause stimulation and secretion of prolactin. Certain other factors like dopamine via the D2 receptors, L-DOPA, apomorphine, bromocriptine and related ergot derivatives, glucocorticoids, and thyroid hormones all are inhibitors of prolactin secretion. Now here are some of the clinical perks associated with prolactin. A prolactin level above 150 to 200 nanograms per milliliter is almost always due to a prolactin secreting pituitary adenoma. Any damage to the pituitary stalk or hypothalamus always causes prolactin levels to increase due to absence of dopamine, which is the prolactin inhibiting substance. Note that oxytocin is the hormone that induces uterine contractions and the release of milk but does not produce milk, whereas prolactin is a hormone that stimulates the production of breast milk, whereas prolactin is the hormone that stimulates breast milk when a person is pregnant or during breastfeeding, but it does not cause the release or the ejection of milk. That concludes our discussion on prolactin. We hope you liked our video and we look forward to seeing you in our next video.